about ask for a while, and when I was trying to figure out a quote, I couldn't help but think of that it was appropriate. Smile for Kids here in Redmond provides equitable access to orthodontic care to improve the self-confidence, health, and resilience of underserved youth throughout Oregon. Christian's going to tell us the whole story. Christian, thank you so much.
Thank you, Chris. I really appreciate it. So thank you very much for a warm welcome, and it's, I have to say as a visitor, it's just really cool and goosebumpy to hear all the stuff that Kiwanis does and all the good that comes out of this group of people. Really any service organization, but it seems like you have a really cohesive approach to that, which is awesome. I spoke to leadership, Redmond last week. Mary Hamilton was there, and I think Carl, you might have been there as well. And discovered that a PowerPoint presentation where I'm like pointing and stuff, it doesn't really work that well. It's not quite as engaging. So I just decided to go off the cuff, and each one of you should have a copy of our current flyer on your table. And you should also have a printout of the current statistics that we have at A Smile for Kids. And the reason why this is important as we go along, and I'll limit it to like 15 minutes or so, and so then you can ask me questions, is that I'll refer a lot to the material that have been distributed to you. So I think it's important for us to start with, although Chris, you did mention the mission statement, that is really our guiding light, that's our North Star. We provide equitable access to orthodontic care to improve the self-confidence, resilience and health for underserved youth throughout Oregon. So we serve all 36 counties in Oregon. We just happen to be placed here in Redmond. That's our headquarters, and we're very thankful for that. But there's not a special focus on Central Oregon. We serve every single county. By a show of hands, not how many of you have been affected by, but how many of you have had to pay for either your own braces or your child's braces? Wow, that's overwhelming. Okay, how many of you had braces as a child? Okay, so braces cost a lot of money. I think we can agree on that, right? And so you may have been fortunate, you may not. I don't know what your background is, but we specifically focus on the kids throughout Oregon who don't have access to resources. So this is really important for Ridgeview people to know as well. If you know friends there, or schoolmates, or teachers who need to know about it, we work very closely with FAN. Please send them to us, okay? But we work with kids from 11 to 17 who don't have the funds to pay for braces. The average cost is about $6,000 right now for braces. And that's if it's sunny and 72 degrees. No extractions, no oral surgery, none of that stuff. It's just straight on braces. Well, that's not how it works in reality. We usually have extra services and treatments that need to sort of accompany the braces. So in many cases, we end up paying closer to $7,000, $8,000, $9,000. Fortunately, we have a really good relationship with Shriners in Portland. So for really expensive orthodontic surgery, like $40,000, $50,000, we can send the kids to Portland for that. But you get the idea. It costs a lot of money. So the reason why we exist and have existed since 2004 is because the Oregon Health Plan doesn't cover braces. So any child in Oregon who's on the Oregon Health Plan, that means they're receiving Medicaid services, which is 465,000 kids right now in Oregon, they have to come up with $6,000. That's just not going to happen. So I guess what I would say also is we're not trying to create model kids, like beautiful photo models, that kind of stuff. That's not what we're after. And I'll get to the extra sort of elements that are really cool parts of our program. We are just trying to help kids remove a social barrier so that they can learn how to feel success in school. They can come out of their shell. They can come up above the radar because they're professionals at staying under the radar. When you have a social barrier, like, for example, the girl on the left, we're not going to mention her name, happy girl, right? But imagine 8th grade, and you have teeth sticking out like planks. How hard is 8th grade already? It's not the prettiest time in many of our lives, necessarily. and especially when you have that to contend with. So we help remove a social barrier, we help them feel success in school, and sort of move on. But the two other really cool pieces that are part of our program, and this is probably going to touch a lot of you, is that we ask the kids that are part of our program to volunteer 4 hours a month at a community-based organization. That means, that's number one, that means that they have access to see how other marginalized populations live and work and function, because they get to help a community-based organization with that population to get out of their own heads a little bit. It also helps them get resume experience for just work, but also for college applications and later in life. So we achieve a bunch of stuff. We move a lot of what's called social determinants of health for that child. The second piece that we ask the kids to do is, if they're struggling a little bit in school and it's one of those situations where they just need a little incentive, so I'm not talking about cognitive disabilities, that sort of thing, but you know they can do it, they just need a little help, a little push. We ask them to lift their grades in all classes to a C or above before they can get braces. So we can approve them and we can tell them, yep, there's an orthodontist who's ready to put braces on you. All you have to do is lift your grades to a C. So what that means is that we work very closely, like I mentioned, with schools. FAN in Central Oregon is a strong partner for us because we need to know so many things in the child's life. We need to know how they function in school. We need to know what we can do to help them. We need to know what's going on at home. Are they living in a car? Are they an unaccompanied minor who's raising themselves? Are they being raised by a sister or a brother? That kind of stuff. You know, and so one of the things I wanted to draw your attention to when you look at the statistics, this is for the state of Oregon. We have 128 or 127 active kids right now. We have nobody on the waiting list. That means we're not telling kids you can't have treatment for another 2 years. All you have to do is send kids to us. It's just that so many people don't know we exist. And as I mentioned, so many families and kids that actually need this badly are used to not being given anything. That's just how it works. So we could take more kids. We would love to take more kids. We just don't get the referrals. But those two pieces, and this is one of the critical things I should mention in the interest of full disclosure and transparency, Brenda Turner is actually the president of my board. So I'm behaving today. And I've asked for that purpose both Peter and Josh Werner not to heckle me. So, yeah, I know, exactly. But one of the first things that Brenda told me when I was interviewing with Brenda and the board is that the orthodontics are really just a hook. What we're really trying to do is help kids graduate from high school. So the graduation rate for the kids that are in the ASK program is at 93, 94%. Wow. The state average is 80%. Every time I get it, I get goosebumps because it is so impactful, because they all of a sudden have this really unique thing that's only important to them that they can work for. And so that's what drives that motivation. And so that's what we're really proud of, is the graduation rate. And we don't care if they go to college or get an apprenticeship, or really just at that point need to go out and work, because for a lot of kids, they just need work, they just need income, right? They've lived a childhood surrounded by no money. So some kids just need to work, but we are aiming to help them find a secondary education, if they have the propensity for it, and then sort of help them get towards that direction. I should also say that we're incredibly, very, very thankful for Earl and Margaret Fisher, because they actually took on one of the kids in our program. They're sponsoring a child, and the impact it has to this child is phenomenal. That's something that Earl and Margaret Fisher knows, that people who sponsor kids know. So the way we're funded, and I'll be mindful of time here, because we're a nonprofit organization, 501c3, we operate entirely on donated funds and grants, and any kind of opportunity for corporate matching grants or funds, anything like that, is that we obviously ask for donations, and I do have some door prizes as well that I'd like to give out for, and you'll see how that's relevant here in just a second. But we have, besides those individual donations, the small fundraising efforts, Facebook birthday fundraisers here and there, we have to constantly find new ways to do this because, remember the amount I mentioned, $6,000 is the average cost per brace, it's called an appliance, but per braces installation. We pay the orthodontist, and we work with 80 offices in Oregon. So we don't actually do the work. We just do the funding. We do the vetting for the kids, make sure there is no money available, make sure that they can be compliant, so they need to be somewhere in the neighborhood of 2 to 3 years in the same area so that that orthodontist can work with them, which is also a challenge. Yeah, exactly. And so those 80 offices love what we do because we pay them $3,000. And that covers their materials, covers their staff hours, and they get to say they do pro bono service for the community. So it's just a win-win-win-win situation for everybody involved, which means orthodontists, in some cases, are tripping to have more ask kids come into their clinic. Also because they know they're going to be compliant. They won't have no-shows for the appointments, which is very important for the medical community and the dental community right now, especially during the pandemic. They've lost a lot of revenue from no-shows in those clinics. And so they know they can count on ask kids to follow through on their appointments because we manage the compliance. We're always on the kids. We have some great program manager, Diane, and program director Michael, and they have that sort of motherly talk every once in a while with a child if we're not getting feedback from them. Hey, you got to get to your appointment. You got to do this. You got to do this, and they're like, okay, yes, ma'am. And so then it sort of gets back on track. But so to make a long story short, you can imagine with 127 kids active. $3,000 per child. I mean, somebody could do the math. And that's on a low year. This is coming off the pandemic. A lot of kids were able to hide behind the masks during the pandemic. And now the masks are coming off. So we're seeing an uptick in applications now because social services, school counselors, nurses, coaches, they're all seeing the kids now. And they're like, oh, you could really use braces. So on a non-COVID year, we're usually in the 200 range. So that's about $600,000 in braces that we have on average walking around Oregon. We're not going to get there by doing Facebook birthday fundraisers, all the time. So one of the things that we do is we ask teams like yours, or we ask work teams, or any kind of team building, principle or philosophy or group, we ask if you're interested in sponsoring a child like the Fishers did. How many members do you have in Kiwanis right now? Just ballpark.
54.
Let's call it 50, make it easy. And you don't, I'm just going to come out and say it because I have to ask for these things. I'm a nonprofit, right? I'm going to ask these things. If you decided as a Kiwanis club to sponsor one child, and then pay it over a year, $3,000 over a year, 50 members, that's $5 a month per member. And the impact that you have on this child's life is insane. It's upside down, it's 180. And yeah, I can't stress that enough. So, what's new in our world is that we have worked hard to testify to push the state of Oregon and Medicaid in Oregon to cover orthodontic benefits for the OHP population. So finally now, as of January 1st, the very severe cases will be covered. So I'm not talking about a little gap between the front teeth or a canine still out of place. That's not what we're working with, right? We're working on situations where the handicapping malocclusion is so severe that it impacts the way they speak, eat, sleep, and breathe, which is not covered right now. Oregon is one of the last states in the union that doesn't cover it, and it's just incredible. especially because on so many other fronts, and I know it's not the general feeling probably, but on so many other fronts, Oregon is actually pretty high up when you compare us to the 50 states in terms of the kind of health care that we have. So the bottom line is that the state's going to be covering some of the very severe cases, which means we can cover more kids who don't have the severe cases but still need braces badly, right? And still suffer. And when I say suffer, I really mean it. We've lost a few kids to suicide because of the bullying. Because the bullying is relentless now, right? It's not just when you're in school, you guys know this. It's 24/7 because of the internet and online presence. So it's so severe that some kids just say, I can't do this anymore. I just cannot do this anymore. And so, again, we're not looking for a cosmetic fix. We are really looking to change some lives out there. Before time runs out, I feel like I would like to just ask you what questions you have for me. I'm sorry.
I've been bothered by this bottom line right here.
Yeah.
79 kids are female,
Yeah.
and 49 male.
I am so glad you picked up on that.
Care to comment?
I would love to comment on that. And that, we think, has something to do with the image industry. So for girls, it could be more, I don't know if it's more important for them, actually, than it is for boys, but people around them think it's more important for a girl than it is for a boy. So more girls are referred to us. Isn't that, yeah, I know, right? So thank you for pointing that out. We'd love to fix it. You just need more referrals. And so we are trying to make that point when we go around and talk to people.
And when you do the next line,
Yeah.
rural, urban, and frontier.
Yeah.
What in the world is frontier?
So these are three categories. Thank you for that as well. So these are three categories that all the 50 states in America are split into from a zip code perspective. So it's a way to indicate if somebody, for example, lives in Paisley versus Albany versus Portland. Paisley being a frontier community. Does that make sense?
Yeah.
Okay.
I guess it
We
does.
were just wondering
Yeah.
where it was in Oregon. And
Yeah.
you said Paisley. We're like,
So, or halfway, let's say someone lives in halfway, right, by Baker City. Sorry if I offend anyone who's from halfway. But the reason why I think it's important to show you that we reach kids even in those communities is because we've been inventive with orthodontists who travel to small dental offices once a month or once every 2 months and practice orthodontics out of a dentist office that they borrow for the day.
I see.
Yeah. So, and the rural kids and the frontier kids are especially susceptible to flying, to being not found, And so it's really critical for us, and especially because we live in Redmond. We live in a rural community. We understand how that works, as opposed to living in one of the bigger cities. Josh, you had a question.
Yeah, what is your full capacity? I mean, you said 137 or whatever it is you have now.
Yeah.
That's not your capacity.
No, we can do, with one program manager, we can probably do 200 effectively. But it's just a matter of hiring more people and generating more funds. So if you could just please open up the workforce, Josh, I'd love that. I should say, Mary, did you have a question? Yes, go for it.
So do you have someone on the ground in like Klamath Falls?
Our orthodontists are the ones on the ground. So the treatment coordinator, the front desk person, we have such strong relationships with them. So for example, the two orthodontists we work with in Klamath Falls is just off the cuff, it's Buck and Wally. And so we've worked with them for many, many years. And they know what's going on. They're really good about taking new kids from us. But yeah, so those are the two that we work with there. I should mention that with this new state benefit, without revealing too much about the sort of the future of what we're doing, because it's all up in the air right now, but we have been asked by some of the dental care organizations, some of the bigger ones, to manage this benefit for them. Well, so when you're going from, let's call it 200 kids to 2,000 kids, We're basing those numbers on what Washington State is already doing. Obviously, to your point, Josh, we have to change things a lot for that program, but we're working to figure out how to solve that. The state doesn't really want to manage it. The coordinated care organizations don't really want to manage it, like Pacific Source in this area, for example. And the dental care organizations don't really want to manage it because they don't have relationships with orthodontists. We do. Like Capital Dental, who owns all the Smile Keepers and General Dental, or Advantage Dental. There's 5 of those in the state of Oregon. They have never covered orthodontic benefits before, so they don't have relationships with orthodontists. So, again, without getting too far into the weeds on this, you can see why it's beneficial for them to ask us to have relationships with those orthodontists and manage the program instead of them doing it. So, to your point, Josh, we are thinking much bigger than 200, but we are definitely all on board, and Brenda can vouch for this, with the fact that that ask in its current form is going to continue, because there will still be a lot of kids falling through the cracks. Yes, Earl.
Just a comment is that the program really does make a difference in an individual's life. Sometimes we give money to organizations and it goes into, in a sense, a black hole. We gave money to something and we trust and we are assured that it gets out to the public. This helps an individual. This helps the kid. And I'm glad to see you reach out to the rural communities.
Yeah.
Those people who live, you notice on the numbers, 49 kids in urban areas. What percent of our population lives in the urban areas? Should be a whole lot more percentage-wise.
Yeah.
But they have other services that those kids in Paisley, those kids in Halfway, they don't. We forget about them.
Yeah.
And we've got to take care of those kids, and this is one way of doing it, so I really appreciate what you do.
Thank you, Earl. Yes.
Also, I'm a former educator also. I just wanted to thank you for linking the two things together, with the academics and the incentive to go on, because it works in so many ways.
Yeah.
Thank you.
You bet. Yeah, that's awesome. Thank you, Ann. Oh, sorry. Ann?
Well, I'm just, as a former board member, I'm wondering if you've made an application to our board for funding, rather than
Absolutely.
From each of us, we would probably fund money.
How do I do that? Chris Ritchie. Okay. Thank you, Ann. I will definitely connect with you. Yes.
Oh, so I just wanted to make a comment. I'm actually a former Smile. I used to, I got my.
Oh my God!
Guys,
Did someone plan?
you guys funded my braces.
That's awesome. Thank you so much. Oh my God! Can I give you a squeeze? Okay. That was awesome.
It really does make a difference. I think it really shaped me into the person that I am now. I have like 2 years of volunteer experience from it.
This is incredible.
Schools, yeah. I started my journey in volunteer.
Thank you so much.
It means a lot.
Yes. Wow. I can't say anything now beyond this. This is just a wonderful way to end it. Thank you so much for letting me talk here today. Yes. Yes. Yeah, that's okay with you.
You want to get a picture in here?
Okay.
Sorry guys, I have a new phone and I don't know how to use it. There's my kids. Just, Chris, you get in there too. That is so awesome, you guys. That's how those things work. It's not as close as you think. Thank you guys. That's so cool.
Thank you. That's awesome.
Christian, we have a little parting gift for you.
Oh,
Just to say
wow.
thanks.
Thank you so much.
Appreciate it.
Oh, and I do have 4 boxes of bottle drop bags if anyone's interested, because we participate in that bottle drop. So if you have empty bottles, let's say you drink a lot of soda, all you have to do is fill the bag and drop it off at the bottle drop. It has QR codes, everything, and then we get the money for it. Thank you.
Awesome.
So, Chris, is there a way we can connect them to all the Kiwanis in the state?
Oh, God, yes. Yes. Oh, my God, yes. If you know any other ones,
That's why you brought some money.
that's awesome, Mary, thank you.
Yes, there's a lot of opportunities. Christian and Brisa, thank you. That was a cool connection. Really appreciate that. That takes some courage. Thank you. Thank you, everybody. Christian, thank you. Thank you to our guests. We're ahead of time, so with that, I'm going to give you 3 minutes back to your day to go make the world a better place.